Hey, have you ever been to the doctor or the clinic and you're told that all your labs and all your tests were normal, but you just felt like crap? I hear this a lot. Hey, it's Dr. Eric, the fitness physician, and I talk about all things related to hormonal fitness and muscle medicine is my main practice. I do health and performance optimization, so much more. So again, I hear this story a lot, and I see a lot of these posts on social media and hear it from people all the time. Maybe you go to the clinic, you go to the even your therapist or your trainer, your nutritionist, and you get checked. Maybe you're feeling tired. Like one of my patients, Gina, she was just tired, gaining weight, bloated, just not getting there, but always sluggish. She had zero drive, zero sex drive, tired all day long, drinking coffee all day, chugging Monster, but still not getting through the day and getting home at the end of the day and crashing on the couch and just wanting to tap out, right? Your get up and go is got up and left. Maybe having, does this sound familiar? Maybe you have some brain fog, your memory's off, your libido's down, and again, you just kind of power through the day and you just don't feel like it. So, and then you go get looked at and everything's quote unquote normal, right? But normal is not optimal. And again, I see this all the time. That's why I look at the patient first and I have to do a deep dive into their actual cellular metabolism. I look at their muscle mass, I look at their metabolism, their hormones, do a deep dive assessment, kind of see what's going on. Like I said, labs may be normal, but it doesn't mean what's actually in the cells is effective and at optimal levels. What I see happen a lot is that a blood test is just a quick test, a snapshot of what's going on inside your cells, inside your body, actually. It's telling what's in the blood, but not what's in the cells. So hormones, all your vitamin D, all these different markers you see on a blood test, again, they have to get into the cell to do their job, especially hormones. They act more like steroid molecules. They actually have to get into the cell and get into the DNA, into the nucleus, and actually do their job. So if they can't get into the cell, they're not going to work. So you could have plenty of it floating around in your blood, but it's not getting into the cell to do its job. That's why I see this a lot with thyroid hormone, for example. Levels are quote unquote normal, but they still feel tired, cold, dry skin, dry hair, constipated, brain fog, feel depressed and blah. But their labs are normal, right? And again, oftentimes they're not because you have to look at all the labs. Most clinics and physicians don't look at all the labs. They just do a couple different tests. I do multiple tests for thyroid, multiple tests for hormones and lipids and so much more. And again, this comes down to cellular metabolism, and it can be from toxins, from inflammation, nutrient deficiency, stress, lack of sleep, so many other factors that play into this. In my Primax VIP program, I created my own comprehensive metabolic and hormone laboratory panel. And that's what I look at. I look at that, and I really spend a lot of time with my clients, asking them a lot of questions, finding out about underlying issues, looking at the labs. I do a health audit, and I do a deep dive assessment, look at the gut, look at many other things, put all these things together, and then I can get things working. So sometimes it's a question of figuring out why the hormones, the nutrients are not getting into the cells and fixing that, not necessarily just giving them more of it. That's not always the answer. And that's what most people do. Oh, just take more of this or take more of that. Sometimes it's not the answer. Sometimes you have to do less, but fix something else. And that's what I do all the time. And I did that with Gina. Now she's feeling great. She's crushing at the gym. She's having great sex. She's sleeping through the night. She's feeling better. And that's what I do with my health audit and my assessments, my VIP program. So if you've been there, your doctor, still not feeling well, let's get to the root cause and figure it out. If you're ready to get started, reach out to me at drericprimax.com. Check out my VIP program. Put the link below. Reach out to me. I'm doing telemedicine all across the country. Let's fix this. Let's get you feeling better, get you optimized. Remember, normal is not optimal. Let's figure out why you're not optimal and get you there. Thanks much. Everybody have a great day.